All right, everybody, we are recording. If you bear with me, I am managing the technology aspect of this and managing, I think I'm freezing, but there we go, and managing the actual meeting. So if you could just bear with me as if I stop talking because I'm letting somebody in, then I might have to do that. And I've got, looks like I have, people are still coming. Looks like I do have a note taker. So like I said earlier, if you have a note taker, I'm going to have to kick those out, or any AI, I've got to kick those out. That's just BHA policy, so just be aware of that. Hi, everybody. I got some people on camera. So oh, hi. Hey, Jennifer, how are you?
Good, thank you.
Hello. Hey, Nancy. All right, so we got a good group here. We've got a good number of people here. We got 48, including me. Pretty good. Oh, there's 49. All right, so welcome to the JBBS community meeting for it is September. I had to look at the calendar to figure out what month we're on. So September, I just want to put it out there that I apologize ahead of time. I messed up. I was supposed to change this meeting to 1 p.m., not 2 p.m. So if this meeting is a really bad time for you, that is completely my bad. I am sorry. In the future, this will be our last learning community or roundtable meeting for calendar year, 25. We will have a quarterly meeting next month in October that will be from 10 a.m. to 12 p.m. But in the future, learning community meetings and roundtable meetings will be on Wednesday, but it will be at 1 p.m. to 2 p.m., not 2 p.m. to 3 p.m. So that is my bad. I apologize about that. So with that, since you got a bit of an introduction, I am Becky. It says Rebecca at the bottom. I do not go by Rebecca. I go by Becky, but I can't change it. I am one of the JBBS program managers for BHA. Kelly Russell is my colleague that manages the other half of the state. She could not make it today, so she apologizes that she couldn't be here today. I'm going to go ahead and have a couple other BHA folks. We've got them introduce themselves. Alex, are you here?
I am here. Hi, Becky. Hi, everyone. I am Alex Clayton. I also go by Alex, even though it says Alexander. I prefer Alex. And I am essentially the data coordinator for the criminal justice programs here at the BHA. And I work closely with Becky and Kelly on BHA data and JBBS specifically. So I will turn it over to anybody else. Is Danielle here?
I was actually searching and I don't see Danielle, so it might just be you and me.
Just us. All right, cool. Well, back to you, Becky.
Thanks, Alex. And Alex has to jet here at about 2:30. So you've got Alex for now. After 2:30, you're just going to have me. So lucky you all lovely people. Just get to deal with me today. What I would like you to do, if you can, please, if you can pop your name and county in the chat, that would be wonderful. I know we will have a lot of dings and we'll have a lot of notifications come up for a short period of time, but that is all good. We're trying to capture who is attending these meetings and frankly, who is not. Because as we sent out a reminder that these are contractually obligated to attend. So thank you everybody for popping that in the chat. While everybody is putting that in there, I am going to go ahead and I don't know who we have from Bridges today. Maybe raise our hands. Who we have from Bridges today? Got 1, hello. 2, hello, 3, all right, 4. Awesome. We've got 4 people so far from Bridges. So I am going to let you all introduce yourselves and your program because I'm not sure who would like to go first. So while folks are putting their information in the chat, I'm going to go ahead and pass it over to the Bridges folks. If you cannot share anything and need to share something, please let me know via chat or shoot me an IM and I will make sure that you can share something. But I will go ahead and pass it off to Bridges folks.
Great. Thank you so much, Becky. Hi, everyone. My name is Jessica Spindler, and I am the clinical director here at Bridges. It's really nice to meet all of you, and I appreciate the time that you all have taken to chat with us today. We have a little presentation for you all, but I'll kick it over to Bree to introduce herself.
Hi, everyone. I'm Bree Cole, and I'm our legal director with Bridges. Also really happy you invited us to come chat with you all today and hopefully give you some more information about how we can better collaborate. And I know we have Letitia on the call, so I will kick it over to her.
Hi, everyone. Thank you all for joining us. I'm Letitia Quintana with Bridges of Colorado. I serve as the Service and Resource Equity Director, and I'm really excited to tell you all about our program and get some ideas and feedback from you all on how things have been going with our work together and how we can continue to be good partners. Would like to pass it on to Vanessa.
Hi, thanks for having us. I'm Vanessa Lichtenberg. I am one of the senior regional managers that oversees regional managers throughout the state. And I don't know, I think that was 4, right? I don't know if anyone else is on.
I think that was 4. I saw 4 hands, and so I think that was everybody. And it looks like my
Perfect.
screen is frozen in a weird position. So if that happens again, I apologize. But yeah, thank you folks for being here. I appreciate you joining, and I will let you share whatever you need to share, and you have until 3 o'clock.
Awesome. Okay. Let me see. So sorry. Let me see if I can get this going. I'm hoping.
Yep,
Can
that
you
works.
can you all see? Okay, great.
Yep,
Sorry.
It's
My Google Beats is not showing me anything, so I can see the presentation, but just wanted to yeah, okay, great. So sorry.
just so you know, it's not in like regular presenter view. Like we can see the slides on the side, which is fine. We can still see the slide you're on, but you might want to change the view if you want
to. Okay, let's see. Did this one work so you all can just, well, it's loading on my end.
There, that's beautiful. Yes.
Perfect. Thank you. Thank you all for hanging in there with us. I am a social worker by trade, not a tech savvy person. So thanks for bearing with me. So we had a little bit of put together a presentation for you all to just chat a little bit more about who we are and what we do and the participants that we serve. At any time, please feel free to throw a question in the chat or just come off mute and ask any questions to any of us. We're happy to have a conversation and a dialogue about the work that we do and ways that we can best partner with you all. So please feel free to interact at any time. So a little bit about Bridges to get us started. So our mission, vision, and values are really what drive us in this work that we do with folks that are really caught at the intersection of criminal justice that have significant mental health needs. So similar to all of the beautiful and wonderful work that you all are doing, we're really trying to be a complement to that as well. So our vision is that all individuals in the criminal justice system are treated fairly and humanely and with dignity, regardless of what is happening with their behavioral health or mental health challenges. Our mission is to promote those positive outcomes for folks that are living with mental health or behavioral health challenges that come into contact with the criminal justice system. And we're really trying to figuratively and literally create a bridge between the systems of the behavioral health systems of the criminal justice system so that folks have access to the care that they need in the least restrictive possible setting and can be really successful and thrive in the communities in which they live with access to the care that they need. So how we go about that is through our values, which lead us in the work that we do in our model of care. So we're person-centered first and foremost. We operate from solution-focused and collaborative lenses in all of the work that we do, both with participants and with community and court partners and amongst ourselves. So this is all information I'm sure all of you are really aware of statistics-wise, but the reason Bridges was created is because of the need of people that are struggling with mental health challenges or behavioral health challenges that aren't receiving adequate services or resources in their current location and then end up in the criminal justice system due to that. So we talk a lot about in Bridges the concept of quality of life offenses, where if someone has, quality of life factors and social determinants of health needs met, there's a much lower likelihood that the interactions with the criminal justice system would even exist. So People with serious mental illness are twice as likely to be arrested again within 1 year of leaving prison, which is really something that I'm sure we all on this call are aligned with, trying to work out creative ways of transition planning and care coordination ways to make that number go down significantly. So how does Bridges come into the picture? So we have 3 different ways that we start to work with participants. And I apologize, it's a really word-heavy slide. I won't read it to you, but the top pieces are the different pieces of legislation that are important and have created bridges and expanded bridges a couple of times. So we were created with House Senate Bill 18251, which placed court liaisons in every judicial district across the state of Colorado. We began as a very small program within the state court administrator's office. And then in 2023 with legislation, Senate Bill 23-229, that expanded bridges to take us from a program in the state court administrator's office and moved us into our own independent state agency or state office. So if you think about the office of the state public defender, we're the office of the Bridges court liaison. So we became an independent office just 2 short years ago and have really expanded the amount of court liaisons, which we now call Bridges service professionals, on our team. And so we still have service professionals in all of the 23 judicial districts now. But what we did is we looked at the competency need and across the state and across the different districts and tried to staff in each judicial district to meet the competency need in each area of the state. So a lofty goal, but we're getting there for sure. And then Senate Bill 24-1355 passed last year, which established the Bridges Wraparound Care Program, which we'll definitely chat a little bit more about today too, which kind of built a secondary program to our court liaison program. So how we begin working with our participants is that we are court appointed. So the judge has to sign an order appointing a court liaison to work with a participant. And so there's 3 different types of court orders and how we can come into the picture. So the first one being competency, and by statute, by those statutes above, we are first consideration for services is and should be extended to those that are involved in the competency process. So we can work with participants that are both in and out of custody, so they don't have to be incarcerated in order for us to work with them. They can be in the community. They can also start in custody and then move to the community, which is really frequently what happens. And then we can also still be appointed to participants that are in custody and likely to stay in custody. And we'll kind of get into those pieces a little bit in a couple of slides, but we can also be appointed at any point in the evaluation or the restoration process if it's a competency appointment. We also like to stress that it is a lot better for outcomes if we are appointed much earlier on as the case moves forward, but we're happy and willing to be appointed at any point in the person's involvement with the justice system. Our second way that we get appointed is through general mental health. So again, these participants can be in and out of custody. These are participants that are non-competency related cases, but really when a court partner sees that there are some potential mental health or behavioral health needs that would be really supportive to the participant that is involved in the courtroom, a judge can appoint us, or any of the court partners can request a Bridges liaison to be appointed. And so this is really helpful too in some of our smaller or more rural districts where competency isn't coming up as much. And so we can work with really anyone that's involved in the criminal justice system that has would benefit from support to community connections or just resources to support their behavioral health. So general mental health, also voluntary. Participant engagement is another piece to this that I didn't mention in competency. So our orders are specific that they appoint a Bridges liaison to work with a participant. It does not is not a court order for the participant to work with a Bridges liaison. And that is a really important distinction, I think, in both our competency and general mental health orders. And the way that we approach our care with participants is that we're really trying to center participant voice and choice in as many of these interactions as possible. And to be honest, I think has been a really key part of what we call our secret sauce of, allowing the participant to engage in ways that feel most comfortable and safe for them, while also really focusing on building rapport and relationships with that participant to continue to increase that engagement and get buy-in for different ways that we can try to help meet their goals. And then we have our wraparound care program, which is our community-based competency diversion program. So that's that 1355 legislation above. And we have recently, it started to roll out this past April, yes, thanks, Bree. It started to roll out this past April, and it's a slow rollout between districts, as I'm sure you all are aware. And so we're getting ready to, as of October 1st, have our second round of judicial districts start implementing wraparound care. And so there is a compliance monitoring piece to this program. And it really is a competency. It's designed to be a competency diversion program. So someone who is likely to be, who is in the pretrial phase, who's likely to be, where competency is likely to be raised. The different judicial districts have different MOUs in the process, but they've worked with the state court administrator's office to identify folks that would be candidates for the wraparound care program, and then they refer them over to us. And once we get that referral, we really initiate working with someone to get them connected to wraparound care services for them in the community. So where we've been developing our model of care is to really try to provide individualized, person-centered, individualized care plans for each of the participants that we're working with. And based on the need and what's showing up for each of the participants, really build in resource providers that can help provide that wraparound care. So while we don't have the in-house psychiatry, behavioral health, nurse, case management model, similar to an assertive community treatment team, we're really trying to work with providers that are in the community where the participant is at and build in those services for that person, and really kind of maintain being a liaison between the community partners that we're working with and the participant, really supporting with the warm handoffs and care coordination piece to try to make these service connections as successful as possible for the folks that we're serving. And so it's a blend of high fidelity wraparound care and assertive community treatment is where our model of care is kind of sitting with our wraparound care. And so as the participant is enrolled in wraparound care, we will be working with them for around 6 to 9 months. So it's a very short period of time. And if and when the participant is successful in working through their individualized care plan that we create with them, all of their charges will be dismissed at either the 6 or 9 month mark. And so there is a compliance monitoring component to it, where if a participant is not engaging with the service providers or isn't engaging with us for a period of 30 days or longer while they're in the program, then we do have to report back to the court and let them know that that there is non-compliance. And then from there, it doesn't necessarily always mean that they'll be moved out of the program, but there's a likelihood that they could be. So I will pause right there. And Bree or Letitia, is there anything that you'd like to add?
I'm just wondering if anyone has questions at this point on like kind of three main categories. I know that's a lot of information at once about the sort of three different ways we get appointed to cases. I think, yeah, that really covers it from our end, but just wondering if anyone has questions.
And please feel free to pop your questions in the chat or just come off mute as stated earlier.
Awesome. Okay.
Letitia, jump in if you had something.
Yeah. While people are thinking if they have any questions, and also feel free to throw them in the chat, I am curious, by a show of hands, it looks like there's 52 others in this meeting besides our Bridges team. How many of you have worked with Bridges before? I'd like to just get some context as we're going along.
Awesome.
That's really helpful. Awesome. Okay.
Perfect.
Yeah, so maybe around 10 or so, at least a fifth of you. That's super helpful. Yeah, I just wanted to kind of get context and appreciate that. But Jessica, you are covering it quite thoroughly. Thank you for leading this.
Of course. Awesome. And thank you all so much for your collaboration with us. We really appreciate the partnership and looking forward to continuing to build it. So we'll keep on going. So a little bit more about just sort of how we operate and what our services look like for participants. So this is our formula of how we work with participants. So we meet with someone, we assess need, we focus on connecting to services related to those needs that we've assessed, and then we share information with the courts. So I think what makes us a bit unique is that we are not in the category of a behavioral health provider. So we're not technically a HIPAA covered entity. However, we do follow HIPAA guidelines. And we are not fully in the legal realm where we have attorney-client privilege. And so we kind of have one foot in each of these arenas. And so we really are intentional in the way that we're working with participants, because we do submit reports to the court on service recommendations, how things, what we feel is the participant's behavioral health best interest is really our focus. And so to determine behavioral health best interest, we really take a person-centered approach. We have different intake assessments that include screening for things like TBI and IDD, behavioral health services, basic needs. And we're really trying to work on what services are needed to help the stability and thriving of someone, ideally in a community, as well as remove barriers to care for anyone, no matter the setting that they're in. And so by building that rapport and personal connection, we're really trying to work on supporting someone engaging in these different service areas across the state and with different service providers. And so really trying to facilitate those relationships and communication and all the things that go into making sure that someone can walk through that front door for an intake and all of the follow-up meetings that happen after that. And then the last part is that we share information. Like I said, we keep judges and attorneys informed about what's happening in the community. With the community-based services, we discuss options and different possible court decisions based on the options that are available for someone. We are neutral parties to the case. We're really coming into the courtroom space to consult on what the behavioral health best interest is of the participants that we're working with. And so that's where a really big piece of collaboration, I think, comes in. Yes, I am happy to share this presentation after too. And if there's other questions in the chat that I missed, please feel free to jump in. But I think this is a really great piece of how we can collaborate is with you all is, you all are treating and working with folks that are in custody or in jail and know these participants day in and day out. And so you are experts in understanding your clients and your participants and what they need. And we can help be a support for you all in either communicating that to the courts and or helping to facilitate the transition and reentry plans once someone is leaving the jail setting and entering back into the community.
It looks like we have a couple of questions.
Okay.
Looks like Sunny has a hand up and then Shannon. Do you all want to come off mute or?
I think those hands might still be up from
Right.
previous question. So that I asked it in the chat, but Sunny, did you have? It doesn't look like we did. Okay, we're all good.
Okay.
No worries. Thank you.
Awesome. Yes, thank you all. So I touched on this a bit briefly earlier, but who benefits most from working with a liaison? And so we kind of have broken it down into different priorities for folks that we work with and folks that our services and connections to services can have the biggest impact on. That being said, we are always willing to coordinate and collaborate and talk through any situation that's come up with someone and really try to help provide as much connection to services and consultation or guidance as we possibly can. So I don't want anyone to think that the higher number priorities are folks that we say that we won't work with, because that's absolutely not true, but it's sort of mostly more so in impact and priority. So priority one being participants who are in custody with the likelihood of being released if stability factors are addressed. And so this also includes folks that are recommended for outpatient restoration. If they're in the competency system, we can definitely help facilitate scheduling evaluations, helping coordinate restoration education appointments, helping with transportation, just kind of all the logistical needs that go into those requirements for someone that's in the competency system. We are happy and always willing to work with folks in that space. So yes, so people that really can be back in the community if they are, had connections to services. Priority two are participants who are already out of custody, but also need support and getting connected to meaningful services for them to help them reach their goals and meet their needs. Priority three would be the participants who are in custody, likely to remain in custody, and I apologize for the typo. And courts and attorneys are experiencing barriers for access to competency or jail-based services. So if there are barriers for folks to just access different services in custody, then we're happy to be appointed to hopefully coordinate and collaborate with you all as well. And then priority four would be participants that are in custody, likely to stay in custody and are already well connected to resources within the jail and competency services. They're kind of connected, and if they're in that space, we're more than happy to be appointed and work with them and work on transition planning for if or when something might change and that status might move, but kind of just to lay out the priorities of folks that we work with. So, and then a piece that we get frequently is how our Bridges and OCFMH, the Office of Civil and Forensic Mental Health, and particularly forensic navigators, how are Bridges court liaisons different than forensic navigators? And the answer to that is that we work really closely together with forensic navigators, but we kind of created this chart to show kind of where the differences, where we're similar and where we're different. What I will say overall and generally is that forensic navigators work only with participants while they're in custody, and once someone leaves custody, they no longer can work with them. And so that's where we have the flexibility in our court liaison program to work with folks both in custody and out of custody. And that's where a lot of our collaboration with forensic navigators comes in, is when someone, when we're working with someone who's in custody that's going to be released, and really making sure that we're supporting and coordinating with the transition care plan. And then kind of, in some districts, it works as like we pass the baton and then Bridges kind of takes the community piece. And other districts, we're really kind of all working together in all the steps of the process. Another big kind of differentiating piece is that we do not triage the state hospital bed wait times. That is the forensic navigators and OCFMH. So we don't have ability or say in moving someone from tier 1 to tier 2. That's where we really collaborate with our forensic navigators and monitor the bed wait times with our forensic navigation partners. So any questions about sort of some of the differences between our two programs? Okay, and we will move right along. So this is a diagram that's intentionally meant to be really overwhelming. And it's designed to just show all the different pieces and parts that a participant and the liaison are working together with as we work with them through their journey in the criminal justice system and getting connected to behavioral health systems. So the participant and liaison are in the middle, and on the left-hand side are the community-based behavioral health and related supportive services. So JBBS is on there as a really lovely partner and collaborator with the folks that we're working with that are in custody. And then the OCFMH and competency-related services are on the right-hand side of just kind of all the different people and community partners that a participant is interacting with throughout their time involved with us and in the criminal justice system. And so as you can see, it's a lot to keep track of. It's a lot of just different care navigation resources. And so really our goal as court liaisons are to provide support and connections to all of these resources and really help with those to facilitate those contacts. And so in our wraparound care liaisons as well. So just a little visual. And then just some general data about Bridges and what not this past fiscal year that just ended, but the year before. We're still working on our annual report for last fiscal year, but 71% of the folks that we served were in the community at the time of case closure. And we had up to a 47% rate of release from custody. We served 2,501 service referrals, and we engaged in 94 successful suicide interventions throughout our work last fiscal year. So we have worked with a lot of folks across the state, and really our goal and our vision is to be a really collaborative partner for services in the community and resources that are already out there and doing really wonderful work, and helping our participants get connected to those providers and services. And so just a little bit of data there. And so talking about collaboration, I know that I've mentioned it a lot of times throughout this presentation, but it's one of our values. It's a huge piece to the work that we do, and wouldn't make the work that we do possible without good collaboration. And so we're really focused on care coordination, transition planning, and warm handoffs, where we see really awesome partnership opportunities is we're always open and wanting to figure out ways that we can best collaborate in the discharge planning process, so that we can also help carry some of the responsibility of ensuring continuity of care post-discharge too. So when someone's leaving custody, going into the community, that's, as we all know, a really important transition point, and sometimes where folks fall off. And that's where liaisons can really be that person in the community, outreaching the participant, making sure that they're getting to those follow-up appointments, facilitating those warm handoffs. We participate in a lot of multidisciplinary team meetings, and just working continuously to build partnerships with other case management or care coordinating agencies at the local level and at the statewide level. So we have a variety of community partnerships that we've been working on through MOUs, and have local resource libraries at our regional manager level of what's in the community that the person's living in, so that they can, transition back into their own community if that's where they want to be. And so I'll pause here for just a second. Letitia, is there anything you wanted to add?
I think one of the things that I just want to highlight is the wraparound care meetings, which it falls in the same sort of category as mental or multidisciplinary team meetings. This is definitely an area where I think our JBBS partners can be great resources to partner it on and participate in those meetings, so that we have a really good sense of what the participants' needs are and what resources are available in each community. And so I just kind of wanted to highlight that when we talk about any type of multidisciplinary team or partnership, it would certainly be inclusive of the roles that you all are filling at the local levels as JBBS.
Awesome. Thank you. Awesome. So another piece of collaboration is really building our provider partnerships and addressing gaps. And so Letitia has done an incredible job as our Service and Resource Equity Director. We have some requests for proposals out right now for different potential transitional housing opportunities for folks, transportation for folks. And so we're always trying to brainstorm ways that we can help address some of these gaps that we all see in the systems that we work within. And it's not just internal to Bridges. So please feel free to always reach out to us, and we're always wanting to hear and brainstorm just different ways that we can strategize finding solutions to addressing some of these gaps of services and resource needs. So with that, we have a participant services fund that we utilize to help address some of these gaps. And so we obviously, like we all wish that we had unlimited resources, because then we could all together, I think, solve a lot of the issues that we face on a daily basis. So it isn't, an unlimited participant services fund, but we do have funds, and we are really intentional on how to equitably distribute those funds to the participants that we serve. But that can look like helping someone get access to basic necessities, or transitional or supportive housing, behavioral health services, medication, bridge medications, if that becomes a barrier for someone. We have funds that can help support paying for someone's medication at the pharmacy if there's a lag in insurance, or whatever the case may be. There have been participants that we've worked with that needed a higher level of care living wise, so met criteria for an assisted living or a skilled nursing level of care. And so what we've been able to do is utilize these participant services funds to be able to move someone directly from custody into the assisted living or the skilled nursing facility while we're working on the long-term Medicaid application, so that there isn't that gap in period of either living unhoused or uncertainty for someone, that they can just transition right into the place that they that can best meet their needs. And so we've worked in creative ways to do that, so that we can leverage these funds to fill that really important housing gap for folks. And then also a big piece is policy advocacy to identify and promote solutions. So taking what we are experiencing and learning from working across the state and all of the districts, and really trying to leverage that experience in informing policy that hopefully helps the participants that we serve get access to services that they need. So again, a really heavy worded slide, so I apologize.
And just if
but
you want me to discuss wraparound care, I'm happy to do it.
Awesome.
Okay.
Yes.
Yes, so this is lengthy, but she addressed it earlier. So really just going a little bit more into the differences in what wraparound care offers. It's really meant to be an alternative to the competency process for folks who are there now or who are likely to be found incompetent to proceed. And so in that program, we're working with folks who get referred to us. So we're still being appointed by the court, and we're providing them really robust wraparound services. This is not totally at all unlike what we're already doing in our court liaison program. So much of the work is similar. The difference is that without the competency system there at all, we're not having to connect people to competency evaluations or restoration services. So it takes out a whole piece of the puzzle, and we can really focus our efforts on serving the participant and getting them engaged in some very meaningful services locally. As she mentioned earlier, the statute is set up so that if people are successfully engaged in the program for a particular period of time, the case can be dismissed. Every judicial district by next July will have the program completely implemented. We are about halfway there as of October 1st, as Jessica was saying. And so, again, the goal is to divert out of the criminal justice system sooner the folks with lower level charges who particularly we've seen come through over and over in the competency process, because ultimately their long-term stability needs haven't been met through competency restoration, which it's not really intended to meet those needs. And so we're seeing some, early success for sure in getting people set up with good, meaningful wraparound care services. It's really early still in the program, so we would love to keep you guys updated on how it goes, and please reach out anytime that you guys might have questions if the district that you're working in, the counties that you're working in, start to implement wraparound care.
Awesome. Thanks, Bree.
Yeah.
Wonderful. So kind of just start wrapping up part of this presentation, because we wanted to give any additional time for just questions for you all too. But the best ways to get in touch with anybody at Bridges. So we have created regional team inboxes. So it's first JD at Bridges of Colorado, second JD. So it's the number of the J and then JD at Bridges of Colorado. So to save you all a little bit of text on the slide, I only gave you examples to the fifth JD, but any JD you could put front 21st JD at bridgesofcolorado.gov. And that goes directly to our regional manager for that judicial district and our senior Bridges service professional. So you will get a really timely response there, and that's just the quickest way to reach out locally. And then from there, the regional manager can help support getting you connected to a specific liaison that's working with a mutual participant or answer any questions that you might have. We also have a general inbox that's monitored by our communications manager on a daily basis. So it's just Bridges at bridgesofcolorado.gov. So if you don't remember the JD inboxes, just reach out to us through Bridges, and you'll get routed to the right person. Dr. Carl Blake is our Senior Manager of Clinical Services. Vanessa Lichtenberg, who introduced herself earlier, is our Senior Manager of Legal Services. Bree, myself, and Letitia's contact information are also on here. Please feel free to reach out to any one of us with any questions. We really have a no wrong door policy at Bridges, where if you are wanting to connect with us and ask questions or collaborate or just chat through something, please don't hesitate to reach out any of these ways, and then we'll all get back to you. And so that wraps up the presentation portion of this afternoon. Any questions from any of that information. Yeah, I think I see Paula. No, I can't see everyone's hand that's raised, but
It looks like Tori has a hand up.
Hi, yes, I do. I was wondering, I work in Pueblo County. I was wondering, currently I've been the one setting up the evaluations in custody. Is that something that you guys would want switched over to you?
so either way works. Are you talking about the competency evaluations?
Yes, I apologize.
Okay, yeah, no worries.
I'll jump in there. I think typically we do defer to the jails as to what works best with them. And so CDHS really is mandated to set those up with the facility themselves. So if they have it worked out with you all that you support the jail in getting the evaluation set up, I don't think we would want to interfere and step into that. That's definitely not like overstepping our role at all. So thanks for the question. It's a good one. But yeah, the local jails all have their own processes, and where JBBS is supportive of setting up evaluations, that's great.
Okay.
Any other questions? I'm very glad to hear the feedback in the chat. Oh, awesome. Thank you, Megan. We appreciate that.
You're welcome.
Actually, I have a question. This is funny.
Yeah.
Is there a specific team in the jails that assist with like the bridges in each county? Teams in each county? Because there's like an assigned team.
Are you saying, is there an assigned bridges team for each county?
Well, I know there's an assigned bridges team for each county, but like for instance, in Larimer County, like the bridges team doesn't have like full clearance to go into the jail whenever, like the JBBS staff does, right? So historically, I know some of the people in the bridges team used to like reach out to us, or I don't know if we were assigned to that, but like now they're reaching out to other teams, which is totally fine. I mean, however way they're getting assistance, right? But I just didn't know if there was like specific team from each county that they're reaching out to, or they're assigned to, or like they're referred to, I should say.
Yeah, no, it's not that formal. Essentially, we leave it to our regional managers in each district to work with their local jails. And to your point, there's different criteria that all the jails have regarding how much access a liaison has. In some districts, we do have full access. In other districts, there's more specific criteria. And so we may work with, you all differently, but no, there's not. You would still just reach out to the regional manager to get in touch with someone if you needed to speak to a particular liaison in that district.
Okay, thank you.
Yeah, sure.
Any other questions coming up? Okay, well, we just wanted to say thank you all again so much, one, and most importantly, for the amazing work that you all do on a daily basis. We're all in this together, and we couldn't do it without you all, and so we're really appreciative of you all and the time that you took today to chat with us. Please don't hesitate to reach out with any other additional questions as they come up throughout your work. We're always happy to coordinate and figure out ways that we can best work together in our roles. So thank you again, and I hope you all have a wonderful rest of your afternoon.
Awesome. Thank you, Jessica. Thank you, everybody. I did want to say for everybody before you sign out, because I had a couple people already hop off, the presentation, if you all would like to send the presentation to me, I can get it sent out to everybody on this list.
Perfect.
As far as the recording, I know a couple of people couldn't attend, so if you'd like to pass this on to folks, my jail folks, Usually once the recording downloads, it actually updates the invite. So if you get an updated invitation, it's not a new meeting. It's just the recording of this meeting being added to the invite. So heads up about that. We will also, so you can access that. Anybody can access that has the invitation. I also will be posting this video to the website within a couple of days. So you'll get the recording via the email or the, what am I trying to say? Invite. You will get an email with the presentation and we'll post it to the website. So 3 different spots that you all can access the presentation. So thank you, everybody. My jail folks, thank you for your time. If anybody has any questions, concerns for Bridges, please feel free to reach out. If anybody, as always, has any questions, concerns about JBBS, anything you'd like to discuss, you got my phone number, you got my email address, let me know. So thank you, everybody, for your time. I'm going to give you 7 minutes back. As I say, go change the world with that 7 minutes.
Take care.
Thanks, everybody. Take care.